Hello everyone, my name is Dr. David Landsberg. I'm the Medical Director of the Transplant Program at St. Paul's Hospital. On behalf of my colleagues at the Vancouver General Hospital, BC Children's Hospital, and the BC Transplant Society, I'd like to welcome you to our video today about living donation. We're going to talk to you about the donation process, the workup for living donation, and some of the things you might expect after you're a kidney donor.
Hello, my name is Shelley. I'm one of the transplant social workers in the province. When discussing live donor transplantation, there are several advantages. I'm going to highlight 5 advantages to pursuing a live donor transplant. First of all, there is documented research to support that the outcomes for a living donor transplant is more successful than a deceased donor transplant. Secondly, a living donor transplant allows you to plan and it allows you the opportunity to possibly avoid starting dialysis prior to receiving a transplant. Thirdly, receiving a preemptive transplant, meaning receiving a transplant without starting dialysis, has better medical outcomes. Fourthly, pursuing a living donor transplant will allow you to avoid remaining on a very lengthy deceased donor wait list. Fifthly, pursuing a living donor transplant is more cost-effective for our healthcare system. There are several factors to consider when making a decision to become a live donor. For example, your financial situation will have a considerable bearing on whether or not you will decide to pursue donating a kidney to someone. Other factors include your health circumstances, your relationship to your potential recipient, as well as your hopes and expectations for wanting to donate a kidney to someone. Living donation comes with some challenges. Time and convenience of testing may be one. Recovery time may be another. And something to consider is your commitment to long-term medical follow-up. A question that's frequently asked is who can become a kidney donor? A kidney donor can be a family member, a friend, an acquaintance, a work colleague. Also, our program has now expanded to allow people to become a donor through our non-directed program and our Living an Anonymous Donor program.
Hi, I'm Sharon Duncan, a nurse with the Live Donor Transplant Program at Vancouver General Hospital. Most living donors are family members, friends, acquaintances, or even work colleagues. You don't have to be related in order to be considered as a donor. In some cases, you may have a potential donor living in another province or even another country. And if that's the situation, then talk to your transplant team. We also have some cases where anonymous donors come forward and those individuals wish to donate a kidney to somebody that they don't know. We'll talk about that a little bit more later in the presentation. With living donation, there are many guidelines which help us in our assessment of the donor. First of all, living donation is a voluntary act, so we want people to be very comfortable with proceeding through the assessment. With that, the donor assessment is really guided by the donor. That is that if the donor needs to take time to get the testing done, then we'll take a break from the testing. At every step along the way, the donor is asked whether or not they'd like to continue with the assessment. The donor and recipient teams are in most cases separate. So that allows the donor to feel as though they're not being coerced or pressured in any way. In addition, information is shared about the donor file with the recipient only when permission is given to do so. We really want to help the donor feel safe and secure in proceeding through the assessment. And donor safety is our #1 goal. Potential kidney recipients in the province of BC will have been referred to one of 3 transplant centres in the province. They'll have been referred to BC Children's Hospital, St. Paul's Hospital, or Vancouver General Hospital. The donor is assessed where the recipient has been referred. It's also important to note that in some cases, multiple donors may wish to come forward, and that's perfectly okay. We're happy to assess more than one donor at a time. Once the potential donor has contacted the transplant center, then they will receive a medical questionnaire and some information in the mail. If the donor chooses to go forward with testing, which is normally done close to home, then we'll send out requisitions for compatibility testing, virus testing, which would include things such as HIV, hepatitis C, and hepatitis B testing. And we'll ask that the donors have a chest x-ray and update some of their annual testings with their family doctors, such as pap smears and mammograms.
Let's talk about matching. In order to receive a transplant, you have to be compatible with your donor. First of all, we need blood group compatibility. We don't need the blood groups to be the same, but they need to be compatible. So somebody who's blood group AB is in the very fortunate situation of being able to receive any blood group donor's kidney. So an AB can receive an A, an O, a B, or an AB. On the other hand, if you're blood group O, then you need to get a blood group O donor. If you're blood group A, then you can get an A or an O. If you're B, you can get a B or an O. So O's only can get O's, ABs can get anybody's. In addition to blood group matching, we also look at the compatibility with respect to tissue typing. So tissue typing looks at how genetically people are similar or dissimilar. Obviously, the closer your genetic match, perhaps the better the outcome. Now, there are some people who get living donor transplants who have a very well-matched living donor. Those give us the best outcomes. Perhaps the most important thing, though, is to make sure that there are no antibodies in your blood, in the blood of a recipient, against the donor. If there are antibodies there, despite all the other compatibilities, these antibodies will immediately go into the donor's kidney and cause rejection. So the most important test that we're looking at is the cross-match test. This is looking for antibodies in your blood against your donor. And if the cross-match test is positive, that means we can't go ahead and do the transplant.
Hello, my name is Dr. Jean Shapiro. I'm the Medical Director of Renal Transplantation at Vancouver General Hospital and the Medical Manager for Solid Organ Transplantation, also at Vancouver General Hospital. The baseline testing results are reviewed with the donor by telephone initially and in person later on if things proceed that way. The donor always has the choice of going forward with subsequent testing because the testing is done in sequences from least aggressive or invasive testing to more invasive testing at the end. And the pace of this is driven entirely by the donor, him or herself. Once you've made it through the initial steps, then the transplant team evaluation is done in Vancouver at either of the two transplanting hospitals. And this visit is a lengthy visit and involves assessment by a transplant nephrologist, a transplant surgeon, a donor nurse coordinator, and a donor social worker. And if necessary, sometimes there are other consultations arranged at the time of your visit. There are some very specific tests that are done and done at the very end of testing because they are the most invasive and involve intravenous procedures and so on. And one of these tests is a renogram, which tells us how each kidney is functioning. And this test is done in the nuclear medicine department. And then a CT scan, which looks at the individual anatomy, again, of each of the kidneys to tell us, for example, how many arteries and how many veins a given kidney might have. And this is what helps the surgeons to decide whether the donor is suitable for this operation or not. The reasons that we decline a donor have to do with medical safety issues as the predominant issue. So, for example, if you're found to have diabetes or pre-diabetes with impaired glucose tolerance testing, then you would not be considered suitable to be a kidney donor. If you have uncontrolled blood pressure, this would also make it unsuitable for us to go forward with you as a kidney donor. If you carry too much weight around your middle and you're obese, this also carries risk for you in the future, and therefore we would decide that it wouldn't be safe for you to go forward as a kidney donor. Some of the more obvious things are if you don't have adequate kidney function, if you have the sense that you're being pushed into this without your willingness or desire to go forward, or if you're unable to give consent for a variety of reasons, or if you have other serious health issues. These are all reasons that constitute why you might not be considered a kidney donor. If this is in fact the case and that is what is decided for you, then this information, of course, is very, very confidential. It is shared between you and your family physician and not shared with the recipient side of the equation at all. If you choose to reveal some of this information to your recipient, that becomes your prerogative and your issue.
When becoming a donor, there are financial considerations. In the province, we now have a program that's administered through the Kidney Foundation that will help donors cover some of their out-of-pocket expenses. The Living Organ Donor Reimbursement Program is administered through the Kidney Foundation, and the initial application is taken by a transplant social worker. The Living Organ Donor Reimbursement Program can help cover some expenses such as travel, hotel, meals, parking, and some childcare. As well, the Living Donor Organ Reimbursement Program can provide some wage loss subsidies.
Anonymous donation or non-directed donation is where an individual wishes to donate to a recipient that they don't know and they've never met. In this case, there are a couple of extra requirements for the donor. And they also have to go through some extra screening in the way of psychological screening at the transplant program. We also ask that the donor has a period of contemplation between the time that they are approved and the actual surgery. And this is just to ensure that they are making the right decision for themselves and to give themselves time away from the transplant program. With the anonymous donor program, the donor is not able to choose the recipient to whom they give. There are two options with the anonymous donor program. The donor can choose to either donate to an individual who's been waiting on our transplant wait list, and the allocation or that individual would be chosen by the transplant program according to established guidelines. The second option is to participate in the National Paired Donor Exchange Program. And as an anonymous donor, you may trigger a domino or chain of transplants, thereby helping more than one individual at a time.
One of the more innovative programs that's come along recently is the Living Donor Paired Exchange Program, or LDPE. This is a Canada-wide program which began in early 2009. It's run by and facilitated by the Canadian Blood Services. And we have found that this has significantly increased the opportunity for transplantation, especially where the donor and recipient pair are either blood group incompatible or where the recipient has antibodies to the donor. There's a very good website which I recommend to you listed below. There are principles and guidelines that govern the conduct of the Living Donor Paired Exchange Program. And these include that donors and recipients must adhere to confidentiality and anonymity guidelines. Most participants live in Canada, and surgeries are planned for close to the same time, recognizing that donors may have to travel anywhere across the country. There are many types of exchanges, as can be seen here.
Hello, my name is Ruth McCarroll, Clinical Nurse Leader at St. Paul's Hospital. I'd like to give you a little more information about the National Paired Exchange Program. If you have a donor who's unable to donate directly to you because they are either the wrong blood type or have sensitivities that shows they will reject your kidney, You are now able to enter the National Paired Exchange Program. Each pair must have an approved donor and recipient in order to enter the program. Several times a year, the Canadian Blood Services will do a match run to see how many potential pairs they are able to find matches for. In this example, you can also see if an anonymous donor enters a paired exchange unattached to a recipient, it creates a sequence of events, helping several pairs receive transplants. So the anonymous donor will give to one recipient, and their donor will give to the next recipient in the chain of events. In the end, because the anonymous donor entered unattached to a recipient, there will also be a donation to the wait list.
There are certainly challenges to the living donor paired exchange program. Both parties require more flexibility, particularly on the part of the donor who may have to travel out of the province for this surgery. There are financial challenges because there is no funding for a companion who may choose to travel with you to the transplant surgery center, and so additional expenses are not uncommon. The whole process requires more planning and waiting. When you're involving multiple centers, it's not quite as simple as coming just to Vancouver with your donor in hand and having the surgery done at one place. Another program which is just emerging in our province is something called the ABO incompatible transplant. And this is suitable for a small number of recipients only. This would be largely a situation of blood group O recipients who might, under very special circumstances, be able to receive a kidney from somebody who is not blood group O, but blood group A or blood group B. This type of program would be considered only after all other transplant options have been exhausted. Recipients must have multiple sessions of plasma exchange, which is similar to dialysis, before and after the transplant, and more immunosuppression may be required.
When it comes to planning the living donor surgery, several things need to be considered. First of all, the donor and recipient both have to be approved. The timing of the surgery can depend on a couple different things. In some cases, a recipient is already on dialysis, so they would be ready to go pretty much any time. In other cases, the recipient is pre-dialysis, so they still have some kidney function from their native or from their own kidneys. So we'd like to be able to preserve that kidney function for as long as we can. So the donation and the transplant would go ahead really when both the donor and recipient are ready. Other things that are considered are the donor and recipient's personal circumstances. For example, child care, finances, and work.
I'm Dr. William Gourlay. I'm the surgical director of renal transplantation at St. Paul's Hospital. If you've completed all your testing and the results indicate that it's safe for you to donate a kidney, then yes, you can live a perfectly normal life with just one kidney, with no restriction on activities or diet. The surgery itself is not uncommon. We do probably 3 a week here in Vancouver. So you're not going to meet anybody in the hospital from anesthesia or nursing who isn't familiar with kidney donation. The surgery is almost always done laparoscopically, and by that I mean a camera is inserted into the abdomen along with 2 or 3 other instruments through small puncture holes, and then the surgery is done through these puncture holes to disconnect the kidney from its surrounding structures. When the kidney is removed, I remove the kidney plus a certain length of the artery, vein, and ureter that come with it. And it's the artery, vein, and ureter that I reconnect in the transplant recipient. Through the laparoscope, we're able to staple the artery, vein, and ureter shut, and then they're cut, and the kidney is extracted through a small incision in the lower abdomen. That surgery takes us probably 4 hours. The laparoscopic nephrectomy is a refinement on the older version of surgery, which we call an open nephrectomy. In an open nephrectomy, which we still do on rare occasions, we need a 6 or 7 inch incision in the flank or patient's side. The main benefit of laparoscopic surgery over the open surgery is in the recovery period. In laparoscopic surgery, it doesn't hurt as much, and the recovery is faster. Occasionally, an open nephrectomy is still required. Either the vascular anatomy is complicated, or if a patient has had multiple prior abdominal operations. If that's the case, it'll be discussed by your surgeon at the time of your evaluation. The recovery in hospital is not very long with laparoscopic nephrectomy. Typically 2 nights in hospital, and by that time you should be up walking, eating a regular diet, and ready for discharge. The convalescence after surgery is about 6 weeks before return to full activities, but most donors are ready to go back to light activities as early as 2 weeks. You can start driving a car and doing light errands around that time. The cosmetic appearance is usually pretty acceptable. The small puncture holes in the upper abdomen heal with a fine line, and the bigger incision where the kidney is actually extracted is quite low on the abdomen, where it's hidden by shorts or your underwear. Also, it tends to heal with quite a fine line. The follow-up after donor nephrectomy is not too arduous. You would typically see your family practitioner once a year to have your blood pressure checked, and there's some blood work to check your kidney function. As I mentioned earlier, there's no restriction on your activities, there's no restriction on your diet, and it's expected that your kidney function, although it won't be as good as the time when you had 2 kidneys, will still fall within the normal range.
Our transplant team is concerned about any issues that should arise post-donation. Our transplant team has an open door policy, and we are available to meet with any donor if a problem should arise. Our transplant team will also help a donor connect with any community resources.
For those people considering kidney donation, if you contact our program, we'll happily provide you with information and education about the donor process. And we'll initiate the medical testing for those people who want to go forward. We're very committed to safe donor outcomes and to maintaining confidentiality, and we'll support the donor whatever their decisions might be.
If you or somebody you know would like to become a living donor, or even if you just want more information, please contact us at one of the numbers on your screen.